The internships are one of the best ways for you first years that are here, the best ways to apply what you're learning in the school, to get that practical experience and exposure, to do good work, and also ultimately to get a job.
I worked for a youth development center called BYA, or as the kids call it, BYA, Berkeley Youth Alternatives.
So my focus in public health is in ergonomics, and working with Ira over at the lab, I was working in the ergonomics program there, and my goal this summer was to focus on laboratory ergonomics in particular.
This summer I was at San Francisco General Hospital, and I was working under the Senior Hospital Associate Administrator.
I did an assessment for Stanford Office of Community Health and also for Stanford Hospital and Clinic.
I was working at the UC Labor Occupational Health Program.
And I was able to go to the Philippines this past summer. I worked with urban poor women in Manila around reproductive health access.
I worked with an organization called Advancing New Standards in Reproductive Health. They are a research think tank organization.
I worked with an organization called Likahan, Center for Women's Health, and I went around to clinics. I helped with policy that they're trying to change. I helped with research. They interviewed women who had had abortions and were discriminated against. They were labeled as murderers and even forced to wear signs at hospitals. I had no interest in doing policy before, but I found out through Likahan that they only take on research and funding, and they only do policy work if it has something to do with the work that they do on the ground with the women.
One of the biggest things Ira actually taught me was that ergonomics is a service, and that's the best way to approach it. You know, you want to avoid you're doing something wrong, and it's more about how can I help you do your job better.
With a pipette like this, it's hard work on the thumb, very repetitive, and also you have to hold your arm up in the air to handle the samples. Whereas with a pipetter like this, you don't have to hold your arm nearly so high, and it's more comfortable to use.
So I really worked very closely with the field supervisor, Bernard, to really help me fine-tune this experience that would help me in my future.
We made art, we made a video.
You are Thank you. Like that.
They made music with a local recording artist. They painted a mural. What I came away with this from working in a real-world agency is I realized that you need to have a plan A, a plan B, a plan C, a plan D, and a backup for the plan D in case something goes wrong with that one.
Looking at putting together an opportunity for her, we realized we didn't have sufficient funding for her, and so the funding through the Center for Health Leadership really helped to make the opportunity possible.
Yeah.
Because Shruti was a student, she was able to access people that staff and other people working in the community don't have access to.
It was very educational.
Challenging.
Learned a lot from everyone.
Exciting.
Heartbreaking.
Humbling.
Fabulous. It was a lot of fun.
I enjoyed my work a lot.
I would say motivating.
It made me feel good. I don't know if one word would be for that.
I had so much to learn from the youth that I worked with that it made school here seem easy.
And all in all, it was just a great experience for me.